this is Kaylee's Slipper Talk. Today we have our orthodontic specialist, Dr. Tiana Bernard. Today we're going to ask some questions about orthodontics. So, Tiana, it's nice to have you here.
Thank you for having me.
So, what is orthodontics?
So orthodontics is a dental specialty that works on aligning the jaw, making sure your teeth occlude right, and making sure that you have the smile you want.
That's very interesting. So, what qualifications do you have to have that allow you to be an orthodontist?
So I did go to dental school like a regular dentist would for my 8 years, and I passed that, and then I continued on for 3 years to become a specialist in my orthodontic.
And what setting is your practice in?
So we have our own building, so we don't just match in with anybody. We're usually our own building and our own specialty office.
And when is the best time to start orthodontics treatment?
So the average that we usually try to start people is around the age of 7. That's usually the best time, but we do get kids that can start earlier, or we do have adults who start at 26 or 32.
Interesting. What are signs that someone might need orthodontics treatment?
If there's a lot of crowding in the teeth, if there's a lot of spaces and gaps, or even just a huge overbite or underbites, anything that a person doesn't like about their teeth, we usually can fix.
And what changes will someone have to make if they get braces?
Some of the changes is, especially if you play sports, you have to start wearing mouth guards because your teeth can get knocked into your mouth, or even the food you eat have to sometimes change, but it's just minor things, not a lot.
And cost-wise, how much would orthodontics be?
Oh, so that changes depending on the patient. It varies so much because someone could come in and get braces for 6 months, and that's going to be so much cheaper than someone who gets them for 6 years, say. And It all just depends on how bad the situation is and how long we have to keep them on.
How to start orthodontics treatment?
So to start, it's really an easy process. You just have to find the orthodontic office that you feel comfortable at, who you can get to, and then you just call and say, hey, I want to schedule an appointment to get my daughter seen. I want to get her into some braces, and I want to get her evaluated, and you're scheduled.
How long does the process usually take?
As I said before, it just depends on the person. If someone comes in and they have crazy crowding and crazy spaces and they need spacers and brackets and all things, then it could take a long time. Or someone could come in with a tiny little baby gap that they want to fix, and it'll take them 6 months.
What are the options or different treatments you could get?
So everyone knows braces. That's the most common type of treatment you can get. But as technology keeps going on and on, we're able to find easier ways or simpler, less noticeable ways. So one of the biggest ones we have going on right now is Invisalign. And it's just a clear retainer that you pop in your mouth every day and moves your teeth just like braces would, but you don't have to have the brackets and everything.
And how would you maintain your braces while they are on?
So we push this so much. Every time patients come in, we always talk about brush and floss, brush and floss. That is your main priority, because when you get your braces off, there's a possibility that you could have a white stain on your teeth if you didn't brush them. So we just push on our patients every time they come in to make sure they're brushing and flossing, just to maintain their whiteness and the same complexion on the teeth.
Do braces change the structure of your face?
They do, and it's not drastically, but depending on the patient, we've had patients come in whose jaws are so overbitten so much that they have to literally get surgery, and it'll move their jaw completely forward, and their whole entire face will change. But not everyone, but in a little way your face will change because your teeth are moving, so the structure of your mouth is going to change, so your face is obviously going to change just a little bit.
That's crazy. After braces are removed, what is the next step?
After braces are taken off, we usually will put you in a retainer. Depending on the patient, some patients like the plastic retainer that they can just pop in their mouth, take it off when they want. Or some people like to get the permanent one, and it's a metal retainer that goes behind your teeth.
Do orthodontics do surgery?
We do not do surgery.
All right, and we also had some questions from the audience that they wanted to know. Someone asked, how do I continue to floss?
So we have these things called floss threaders that help push the floss through the brackets and the wires, and so it just makes flossing easier for them. So yes, you do continue to still floss, and we have tricks and simple ways, and we'll show you when you get put in them.
All right, and someone else said, how often will I come in for checkups?
You come once a month, and that's when we will tighten them, make sure everything's looking good, and make sure the process is going right.
And what food will I have to avoid?
A lot of the foods we ask you guys to avoid is please don't chew sugary gum. We ask sugar-free. We ask try to avoid dark sodas and stuff like that for staining of the teeth. And then we ask you to avoid sticky foods because they can stick to the brackets, break them off, mess it up. And then just hard foods, anything that can just snap them off.
Do braces hurt?
That is one of the biggest questions that people ask, and the answer to that is it is very uncomfortable when you first get them. We are putting brackets and wires in your mouth and moving your teeth, so there is going to be discomfort. But we always recommend for someone to take some Tylenol or Advil before they come in to help with the pain, and after having for so long, you get used to them. There's just always going to be discomfort.
And I am an adult. And should I still get braces?
Anybody can get braces. A lot of people will come in adults, and it'll be people who were able to afford them when they were younger, and now they can afford them and they want prettier teeth and to have straight teeth, so they do get braces. So you can get them at any time.
Well, thank you for being here and
Of
answering
course.
all of our questions. That'll be it for Kaylee Slipper Talk. And we're out.